My name's Anna Bokobza and I'm Programme Director for Integrated Care at Imperial College Healthcare Trust in London. During normal circumstances, my role as Programme Director for Integration divides into two pieces. I have an internal operational portfolio where I'm responsible for our complex discharge function and all the therapists across the trust, so a real focus on patient flow. And separately, I have the great privilege to lead for the Trust on the development of integrated care partnerships and the development of our approach to working with emerging primary care networks. During recent times, like lots of us, my role has focused very closely onto one thing, which has been about reducing the number of medically fit patients that we have in our acute beds, with a view to optimising the capacity for the expected peak of coronavirus patients. Reflecting on my own leadership style during this time, I suppose I've always known that I'm a naturally extrovert thinker. I do the majority of my best work and get my best ideas and energy from working closely and discussing my ideas with a wide range of different colleagues. I typically delegate quite trustingly and am relatively light touch in terms of following through with my colleagues on the actions that I've asked them to do. But during this time, I've had to adapt that to become much more directive in my style and in how I work with those that report to me, which at times has felt a little bit uncomfortable. For example, the discharge hubs that we've set up on each site, we've been able to stand up very quickly through redeploying staff from other organisations locally and from within our own organisation. And that's meant me describing quite directively, as I said, what I need them to do and when. I've tried to offset that with real concern for their well-being through that transition and supporting them to access any services that they need to do the job as effectively as they can. Thinking about inspiring leadership that we've seen in others, we often look to our most senior executive colleagues for those examples. And whilst we've seen loads of examples of that recently, I suppose this period has taught me what I've always known, which is that inspiring leadership can come from anywhere. One example that I would like to describe is that of a physiotherapist in our trust who was working as a team lead in respiratory physiotherapy on our critical care wards. And understandably, she played a pivotal role in setting up proning teams. So these are teams that very carefully turn ventilated patients in critical care onto their fronts to improve their oxygen saturation levels. So a clinically really important thing. Now, we, like most trusts across the country, have had to increase our critical care capacity very dramatically. And this individual, in a very, very short space of time, produced proning teams out of nowhere to support not our usual baseline of 64 critical care beds, but 144, 24 hours a day across 3 different sites. And she did that by really building a case for the hearts and minds of people to transition into these roles, training them because they came from a wide variety of different backgrounds, many of them not with a critical care training at all, and really focusing on their well-being and the PPE that they needed to do those roles effectively and safely. The thing that she did most expertly, I think, was working with a couple of other senior therapy colleagues to create a real buzz on Twitter about how this was done. And resultingly, she has really served to raise the profile of allied health professionals across the trust. They ran a competition in partnership with our hospital charity to win prizes for the proning teams with the best names. So we had the rolling prones, the prone roses, and it brought a certain amount of fun and levity to an otherwise really challenging situation. I plan to do things a little differently myself as a leader going forward now. Spending more time with the frontline teams that I'm responsible for suddenly feels much more important to me than it maybe did before. after a period of family-imposed self-isolation, my first day back at the St Mary's site, I went down to the discharge team who sit within my portfolio, who I don't see as often as I'd like to, and I went down to their office and just had some informal chats with them, and was able through that discussion to pick up some intelligence that I could use to help them work more safely, more happily and more productively, which they'd never have phoned me about those issues had I been working from home or stuck behind a computer screen in the office. And I came out of that interaction really feeling energised. So it felt very important to me to make that interaction and to support them to improve the way that they work. I also plan to lock in some of the collaboration that we have achieved or we've accelerated with many of our system partners. So I described those discharge hubs, which now meet twice a day on our acute sites with colleagues from CCGs, from adult social care, and led by our community partners, which has been so incredibly valuable. So as Programme Director for Integrated Care, I really see my job as to make sure that those steps aren't lost as we reset for the future.